First off, I want to echo what Brent said in a few less words, but for you guys all being out here shows a lot of commitment. It's really impressive, really good turnout out here. What I'm here today to do is talk to you a little bit about the Sport Medicine Center itself, who we are, what we do, and more importantly, what we have to offer your children and your young athletes. I'll keep this fairly brief. Sport Medicine Center is a multidisciplinary clinic. It's made up of a lot of healthcare professionals. There's 4 physiotherapists on site. There's a sports med doc, a chiropractor, a massage therapist, an athletic therapist, and a podorthist. Podorthist being someone who works with feet, footwear, orthotics, that sort of thing. We're basically a one-stop shop for all your injury needs. There's a few things that I think sort of set us apart from other clinics that you may have had experience with in the past. Whether it's been a good experience or not. Because we're a multidisciplinary team, we have a lot of different views, a lot of different people have different specialties, different niches, things like that. So it's not uncommon for us to do a lot of what we call internal referrals. So I may be seeing a patient that's having an issue with a shoulder. Ricky, who's my boss, who is sort of known province-wide as being a shoulder expert, might be having some trouble. The patient is progressing the way we like. Something a little tricky. No shame in getting Ricky to come in there, have a look. Sometimes it's easiest saying, you're on the right track, things are looking good, or maybe try X, Y, and Z. And 9 times out of 10, she's right. I'm not just saying that because she's my boss. Very good at working with shoulders. Another example, you might have someone with a foot, ankle injury, something like that. I might think they need an orthotic, a different type of shoe, something like that. We have Kirk, who's the podorthist. We send them over to Kirk. Kirk has a look, says, yes, they need this. No, they don't. At least we have that peace of mind. So we have a lot of that internal, referral going on. So I feel like we cover a wide base of patients, and every patient sort of gets top-level care. Sarah's very good at dry needling. I don't know if any of you have seen Sarah before. It's not fun to have done, but it's very effective. She works with a lot of people with myofascial problems, things like that. And I'm still waiting to figure out sort of what my specialty is, but that's to be determined, I guess. The other thing that we offer as a clinic that I have yet to see in another clinic is one-on-one care. So when you come in for an appointment, none of our therapists ever see more than one patient at a time. So you come in, assessments are 60 minutes in duration. All follow-ups are 30 minutes in duration. You're with that therapist the whole time, okay? There's no physio aids, there's no laying on heat for 30 minutes while I go jump around to 6 different tables and see 6 different people. It's you and I. It gives us the best, chance of getting the most done in that session. The other thing I really like about it, and I think most people really like about it, is if you have an appointment at 1, it starts at 1. We're never late. You're not waiting in the waiting area. And it ends at 1:30. Because we only see one patient at a time, you come in, we do our 30 minutes, we do our thing, we get things done, and then you leave at 1:30. Very busy. You have multiple children. They have 1,000 places to be at the same time, okay? It makes things much easier to schedule around when you know when you're going to be there, you know when you're going to leave, okay? That's my little blurb about the Sport Medicine Center. I'll stop plugging it for now. I'll move to the more important stuff and why you're here, and that's about what we offer your children and your young athletes. I'm sure as your sports season have gone on, your athletes have gotten injured. That's a normal part of being an athlete. That's a normal part of being active. That happens. What's not normal, though, is to have these injuries at a young age be a nagging, chronic sort of thing. As I'm sure many of you have experienced a lot of times, whether it's a shoulder issue or an ankle issue, they come up every season. So you have, halfway through the season, you're a baseball pitcher, my shoulder's a little bit sore. But they're young, they're athletic, they're tough. They pitch through it, they do whatever. Off season comes, they recover, everything's fine, only for it to come up and flare up again the next season. And then they go through the same process again. They throw through it. They might get a little bit of care here and there, settles out. It just becomes this chronic and sort of cyclical thing. And what I want to explain to you as parents is it doesn't have to be that way, and it shouldn't be that way. Especially for young athletes, it's not normal to have the usual aches and pains like you or I have all the time, okay? The important thing is to get that athlete in and have it looked at. It's often something very simple or some change that needs to be done that can really, affect that athlete in a positive way. Because of this, a year ago, we implemented a new program. We call them high performance assessments. And the reason why we implemented these was you don't need to have an active injury to see a therapist or see a medical professional, okay? You see your trainer, Brent, like Brent was talking about, to get stronger, to get physically ready for the season. You're not going to see them necessarily because you have a problem, okay? That's the same sort of thing we're trying to implement when it comes to sport medicine, seeing a physical therapist, athletic therapist, okay? The high performance assessment is a 90-minute one-on-one, like all of our sessions, basically total body, head to toe sort of assessment. That assessment can kind of ebb and flow depending on what your sport is, whether you're a throwing athlete, whether you're a jumper, whatever you are. Focused on some of your normal problem areas that tend to break down in your sport. And we sit down and we go through the whole assessment and we just look for things that may predispose you to injury, or what could be causing this little nagging injury that you didn't really think was an issue, but just keeps coming back every season, year in and year out. The problem with these nagging injuries is if you leave them for too long, as I'm sure many of you can attest to, they last your whole life. Okay, you have this bum knee that you've had since you were 16 years old, or the shoulder that you just can't throw like you did when you were 20, okay, because you never properly got it treated, okay? That's what we're trying to avoid. Not to mention it negatively affects your child's performance throughout the season, okay? So with the assessments, you come in, we assess it, 90 minutes. Sometimes these are just one-off things. We have a look and say, you know, it's nothing much, work on these few things. If it's not getting better, come back and see you. You're good to go. Other times, you know, there might be a few things we point out. Maybe it's a muscle imbalance. Maybe a joint's just not moving the way we'd like it to. Maybe it's just a little tweak in their training schedule, whatever it is. We, like Brent said, we collaborate very closely with the training staff here. So if you have an athlete that is training with Adam or training with Brent, we talk to them on a regular basis. So it's not uncommon for Brent or Adam to say, hey, I have this patient. His shoulder's bothering him a little bit. Do you mind having a look at it? Just let me know what you think. You know, should we be doing this? Should we not be doing this? They come in, we have a look, say, you know, it's fine. You know, you can work through this. It's not a big deal. Or let's cut back on this. We're going to get them doing some of these exercises. We'll see them for a few weeks, and then we'll, you know, have that communication. That line of communication is always open, and at which point we'll say, okay, they're good to go. You know, do whatever you do. You're the professional. You guys do that stuff. This is just sort of, you know, gaining traction. We've been seeing mainly junior hockey players for these high performance assessments, that we're calling, and with some pretty good success. A few of the athletes we saw last year, one had a nagging knee injury, one had a shoulder that we'd like to think was holding them back a little bit. We got some things sorted out over the off season. They trained with Adam and Brent the whole season. Actually got called up, both of them played games in AHL this season, which was very nice for us to see and a bit of a proud moment. Point here, like I said, this will be brief, is don't ignore these chronic injuries that keep popping up, okay? Have them see somebody. It doesn't have to be me, okay? It doesn't have to be the Sport Medicine Center. If they're working here, if they're working with Adam or Brent, okay, there's no other place that I know of in the province that has that collaboration between therapist and exercise professional, okay? There's a lot of times you go see, have people come in, we're treating them for one thing, they're telling us what they're doing with their trainer at a different facility somewhere else, which is actually making the problem worse, okay? Here, you have a nice collaboration. I can talk to Adam, say, you know, we don't want to do this, very respectful. They'll actually come to us most of the time before we'll come to them. They'll pass, you know, get the sort of go-ahead or the A-OK on their, they'll give us the training program. So say you have your daughters training for volleyball, this is what they're doing. Brian, what do you think of this? From your assessment, is this okay? Yeah, that's great, Adam, go ahead. There's no problems there, okay? So the main take-home point, don't let these things nag on, okay? They can become long-standing chronic issues and affect the performance and the development of the athlete. That's my main goal there. Any questions? Yes? You don't. No, you don't. No referral. Depending on insurance policies and things like that, some are different than others. If it's going to be covered by insurance, you may need a referral, but a lot of insurance companies don't require that. You just call in, say, I like to book a high performance assessment. We have basically all the physiotherapists at the clinic do it, so 4 of us do it. So usually not a lot of trouble getting in. Anything else? No? Thank you.